in time. Welcome everyone to this session where we will share things about the Youth Pre-World Health Assembly. Very excited to be here with you. My name is Iris. I am the IFMSA Liaison Officer to the World Health Organization, which means that I am in charge of our official relations with the World Health Organization, and I'm also the head of delegation to the World Health Assembly. And together with my amazing Youth Pre-World Health Assembly Organizing Committee, we are organizing an incredible event for you every year, and we're going to share some details about that with you today. And it's really exciting that we have some alumni that have been to previous sessions that will share their experience with you. As an introduction, I will just share a little bit of slides with you to get a bit of before we go into the actual discussion. And I'm here together with Hamael and Olga from the organizing committee as well. So here, let's go. So first of all, with regards to Zoom, please do open your camera whenever possible and engage. This is an open space discussion, so we want to hear from you and we want to make sure that we will be able to answer your questions and address your concerns. When engaging, please do introduce yourself every time that you get to speak. So please say your name, what you study, and where you live, so we know who we're talking to and who's in the room with us. Finally, when not speaking, please do mute your mic so that we can hear everyone. So, and quick overview of who is in the organizing committee. It's very exciting for me to officially introduce them for the first time since they've been selected. I'm very, very excited to work with this incredible team. And you can see me there on the slide, and then you see Hamael, who's with us today. She's the general assistant of the OC. Juliette is the program assistant, meaning that she's in charge of the program and the development around it. Then we have Olga, who is our amazing PRC assistant, and she makes everything that you have seen on social media, all the designs, and she works on a lot of things. Then we have Gabriela, the development assistant. She's in charge of logistics, including the finances. We have Adham, and he's the academic assistant for meaningful youth engagement. Meiji, who is the academic assistant for global health education. And we have Mohammed, or he also goes by Nutella, in case you might know him, who is the academic assistant for universal health coverage. So I'm very, very excited to have these incredible people in the OC. They're all very experienced, motivated, and creative. So I cannot wait until we have the final event and all the efforts will come to fruition, because I'm sure it will be amazing. Quick history. I'm not going to talk about all the details on this slide, but I just wanted to say that, well, here you see when everything is founded. And then in 1969, we became a non-state actor in official relations with the World Health Organization. So that means that from that moment onwards, we were able to send delegations to high-level meetings that the WHO has. And that was also the first year, actually, that it was possible to become in official relations with the WHO. So we were right there from the beginning, and we have collaborated with them since our founding. And then I want to highlight this year, 2013, which was the very first Youth Pre-World Health Assembly. And it's very exciting because next year, that means we will have the 10th edition. So it's also a great anniversary moment for us coming up in the next year. So what is the Youth Pre-World Health Assembly? It's a high-level opportunity for capacity building, for building connections with people from all across the world, with high-level externals. It's about advocacy, it's about global health, and so much more. And you'll hear a lot about that from our amazing alumni that will be talking to you today. So it brings together 60 youth advocates from around the world, and they will be engaging with high-level external speakers. And just to make sure that you understand how high level these speakers are, amongst them have been Dr. Tedros, the United Nations Youth Envoy, and so much more. So it's really, really a very high level opportunity to engage with global health decision making at the highest level that there is. So some important dates. So the deadline for application, this is a very important date, is the 1st of December at night. So it's at 11:59 p.m. GMT. So GMT is Greenwich Mean Time, and once it becomes the 2nd of December in GMT, we will not be accepting your applications any longer. Please make sure that you hand in your application on time, because if you hand it in too late, we cannot consider it. Then the dates for the actual event itself, it will consist of 3 weekends and a reflection day. So you will see here on the slide when that is. So the 7th of May will be the first date. It will be online, the 14th and 15th as well. The 18th, 19th and 20th will be happening in a hybrid setting. That means that part of the delegation will be online and part of the delegation will be in Geneva if context allows that. And finally, we will have a reflection day on the 4th of June, which will be online as well. And the 75th World Health Assembly will be taking place from the 22nd to the 28th of May, which we will also, if context allows, be approaching in the hybrid manner, meaning that part of the delegation is online and part of the delegation is in person. So those are the dates to take into account, and don't worry if you don't remember them, because they are all written down as well. So you can find them. So I'm not going to go into the details of this slide, because all of this text is also on the website. So on the bottom of the page, you will see a website, and when you go there, you can find all the details of the application procedure. So do check that out if you want to read again what's on this slide and what we've been presenting before. So just quickly, application criteria: you have to be a student, or you have to have had the student status within 6 months before the start of the event. I think someone's mic is on. If we can just mute them. Okay, there we go.
Me, and I'll be told.
All right. And then we look at your motivation and your interest in global health. Note that international experience is not required, and we have a balanced experience profile. So we are looking for people with different types of experiences. So don't be discouraged if you do not have external affairs experience internationally. And we really encourage you to apply, because we believe that different experience profiles make up for a really diverse delegation with different perspectives. An understanding of the advocacy work that IFMSA does, so make sure to read the background documents to get more of a sense of what that is. And finally, the delegation will consist of 60 people. So the application process: read the webpage at the bottom and the documents that are attached to the webpage very carefully and in detail to prepare your application. Fill in the candidature form. This is really important. The candidature form is signed by your national member organization. And now, just as a side note, if your national member organization is currently suspended, but they will regain their status of validity on the 1st of December, make sure that they sign your candidature form on the 1st of December. If they have signed it before that, during the period of time when they were suspended, your application will not be valid. So make sure to check with your NMO president to see if they are suspended or not. If they are not suspended, there's no issue. They can sign whenever they want. If they are suspended but will regain their valid status on the 1st of December, make sure they sign on the 1st of December. If you're not part of IFMSA, but another student or youth organization, your candidature form needs to be signed by the international board. So the president or someone in a suitable alternative board member. And just to note, the Youth PreWHA is open for applicants from the IFMSA, but also from any other international youth organization. You can fill in the application form and upload your filled candidature form on the website. There's a application form there. And again, the deadline is the end of the 1st of December this year in GMT. So that was quickly the logistics from that. And now I will pass on the mic to Hamael, and I will also ask you to introduce yourself first. And then we can meet our alumni and have a very exciting, get more of a sense of what this event actually is and what it brings to people. So I'm very excited to hear from them, and I'm really grateful that they are here with us. So Hamael, I'm passing it on to you now.
Thank you so much, Aris, and thank you so much for joining us. It's a huge pleasure to have everyone who has played some part in this amazing event over the years to come together and reminisce and talk about these things and inspire each other. So as Iris introduced me earlier, I'm Hamael Sana. I am a 5th-year medical student from Pakistan and the General Assistant to the Organizing Committee to the 10th version of the Youth PreWHA. And now I am going to ask all of our alumni who have joined us today to kindly introduce themselves and tell us which year were they a part of this delegation and what motivated them to join this event. So just a brief introduction. So I'm going to first ask our amazing alumni, Anna, to introduce herself and yeah, let us know about it. Anna, the floor is yours.
Hello everyone. My name is Anna. I am a fifth year veterinary medicine student from Poland, Krakow. Currently, I'm also president of IVSA Global, so International Veterinary Student Association, and I attended the WHA live in 2018 in Geneva, but also WHA online in 2019. Together with IFMSA. Thank you very much for the invitation. I'm really glad to be here with you, and well, such a pleasure to be the first one here. But yeah, I will try to share with you a little bit what motivated me to join this event. So when I joined, I was at the beginning of my studies of veterinary, and I was a little bit engaged in the international work of our association. And then I started to discover global health, public health, and I realized that it's not only for human doctors. I'm sorry for all the human doctors here, but I realized that it must be a multidisciplinary collaboration. And I started to do research how veterinarians are involved in the global health. And I found out that not so many veterinarians are aware of this, of how important their participation, their voice is in a public health, in global health settings, especially like during the meetings like the WHA and collaboration with WHO. So I decided to join the meeting to discover more opportunities for us veterinary students to be involved there, but also to be the voice of veterinarians within the delegation. And it turned out to be a great choice because I met wonderful people from IFMSA, wonderful students from different professions. So not only medicine, but also pharmaceutical studies, also dentistry, chiropractic. And it was basically a great experience. From then on, I'm more involved every year on the global level, and I still strive to promote veterinary medicine and multidisciplinary collaboration within global health. So I hope you guys will have a great experience as well.
Thank you so much, Anna. That was amazing. So now I'm going to announce our next alumni, Zainab. It gives me no small amount of pleasure to announce her because we have the habit of finding each other in different places. But Zainab, the floor is yours. Can you introduce yourself?
Hi, Hamayel. Hello, everyone. Thank you for the introduction. So I was part of the PreWHA and then the IFMSA delegation in 2017. So it's been quite a while now. At that time, I was still a medical student. I graduated since in Morocco, and after a few years of being involved in IFMSA Morocco at the national level, I wanted to get a feel of the international IFMSA work. I wanted to really understand how policy is made in health in an international level. So I applied to join the PreWHA, and it's been a fantastic experience. I've learned so much, and as Antonio, it gave me that extra, kick of passion to pursue global health further. So after I graduated from medical school, I did a master's in international health in the UK. And now I am based in the UK working as a doctor in the health service, but trying to bridge public health and clinical health in my career. So yeah, it has been a very important milestone in my journey. And I'm very happy for all of you who will have that opportunity as well.
Thank you so much, Zainab. And that's truly brilliant, sharing your journey with us over the years. So now let's dive deep about why we're all here. So I would like to ask you, what do you think makes the Youth PreWHA such a unique event? Like what separates it from other events of global health around the world? And if you were to talk about your personal development, what would you say was the biggest takeaway in your leadership skills after you joined this event, and how you applied it in your work afterwards? So Anna, why don't you go first?
Sure. So why this event is so different and so important, I believe, for future healthcare professionals to attend. I think, first of all, because it's so interprofessional and so international. So you are able to meet there, first of all, the members of the IFMSA delegation that are coming from all over the world, from so many different fields, but also you are able to meet their professionals, professionals working in Geneva, professionals working in WHO, and they also have different backgrounds. They are also from many different countries, and you're able to network with them, to chat with them, and you get the opportunity to basically get to know how they got there, to also get to know some tricks and tips for your future career, and how you can really move forward in the future of your career. But also it makes you realize what are the real global health problems happening worldwide, and it gives you inspiration about in which field you would like to work in the future, because global health is just such a broad topic that it's very difficult to decide what is the most important problem for you to tackle. But of course, even though you'd like to, you cannot tackle all the problems happening worldwide in a global health. So you need to find your path, your specific problem you would like to move forward with, and this gives you a wonderful overview because you get to sit at the WHA meetings and you get to hear what the biggest associations like the World Health Association is tackling, what kind of challenges, what topics are currently discussed in the UN, in the permanent missions of several different countries in Geneva. But also there are several side events in case you would like to have some more technical knowledge on many different topics. And then you have the overview of everything. And on top of that, you're able to then go to these professionals, go to these diplomats, go to these people, chat with them, ask all your questions, and then get the answers. And I think this helps you to plan how in the future you would like to get involved and proceed with your career. So I believe that's why this meeting is so different, that it is basically in Geneva with all these people gathered together in there, and it gives you these wonderful opportunities. Yeah, thank you.
Thank you so much, Anna. And yes, I would totally resonate with that. And since last year, more than like 2020, we saw a shift of in-person to a virtual setting. And I was a part of the delegation last year, and I could say that even after we moved our whole engagement and networking to a virtual setting, we still found ourselves finding ways in which we were surprised that, okay, now we have so much more better reach to people in higher up positions, more than we ever used to have in like in-person situations. So I would say, even if we are moving towards an age of digital closeness, we are also finding ways in which we can engage in better ways and even find sustainable relationships. So the same goes, yeah. So I would say that in person or virtual, it is still a unique, amazing journey. So why don't you share your thoughts with us, Zainab, on this? I'm sure you would have a certain take on this one. Yeah.
Yeah, I agree with what Anna said, actually. The PreWHA was the first opportunity for me to meet delegates from IVSA and the pharmacy organization as well. So it was the first occasion to see that medical students and medical doctors are not the only players in global health, and actually understand that they are not even the most important players, which is not something easy to stomach, but it is actually true. That was the first first occasion where you realize, oh, okay, there's actually more players in this game than I thought. And you also understand what the arena of global health is, and what how important the consequences of decisions are for countries, for their entire budget, for their political plan. And so it's really like your first point of entry as a student to the world of adults and big players, to say it genuinely. Also, a really good thing is that it prepares you with very high level speakers and workshops on advocacy and how communication and how to approach people. It prepares you to actually have meaningful conversations with professionals, use the same vocabulary they use, engage them in something that they are actually interested in, and you can find some win-win situations. So it's much more about how to than about, you know, learning, because if you have been engaged in global health for a few years, which I'm sure if you've been selected to be in the delegation, you have quite a bit of experience or understanding, you're not going to learn much more knowledge, but you're going to learn soft skills about how to approach people, how to frame your message, and negotiation, advocacy, and things. And that's very useful. You will not learn that elsewhere.
Thank you so much, Zainab. So many interesting takes, and it all comes down to the message that it is so intersectional. You get such a diverse crowd that it makes it's such an unforgettable experience. Like from all age to all sectors, from all countries to all languages, you find some companions that you will take with yourself for the rest of your lives. So thank you so much for that. Antonia, I would ask you the same question. What, in your opinion, makes the Youth PreWHA such a unique event? What were the biggest takeaways that you took as yourself after this? Like, how does it change you as a leader?
Well, thank you for giving me the floor. I think it's a unique event because it's the highest decision level that you can possibly be in. Because in WHO, the WHA is like the top of the governing bodies of the organization. So you are at the most high-level meeting of health in the world, and I think that's what makes it unique. You can network with people from different countries, from different situations, and here you can see what we do in IFMSA, or what I was doing in IFMSA when I was there, like in real, like making that a policy, and it's an incredible experience to raise the voice for just young people. And I think that's what changed my mind, because I realized that we as young people could change what we were doing. Some people said that young people are the future of the world, but I think we are the present who are changing the future of the next generations. And here at the WHA, you can see that in real life. So that was what makes this unique. And also to be delivering statements in the floor with all the ministers or all the high-level people there, it's really amazing. As everyone has been saying, you get to learn a lot of global health topics, because unless other events, these focus specifically in global health. And I think around the world, global health is lacking in medical curricula. I have seen that in the chat already, and that's a reality. I could speak at least from my region. Global health is not included in the medical curricula. So I know there are efforts through WFME and through other organizations, also IFMSA, to improve the medical curricula or other healthcare related curricula. But I think in this place, you get to learn something that you won't learn in your school. So that's what I think makes it unique.
Thank you so much, Antonio. And as a segue to what you all discussed, so you all come from very diverse backgrounds. Like from the time that you joined this delegation to up till now, you have all had such amazing journeys. It's seriously inspiration for everyone here. But now I would ask you about something more relevant to all the applicants here, that when they're writing their applications, what do you say that what should they consider in their application? So just like yourself, so many people who are joining this discussion today come from very diverse backgrounds. We have mix and match of so many people from different sections of global health and intersectional health. So I would ask you all to share some tips and tricks with us on what can our applicants do to make their applications shine among them all. So Zainab, I would give the floor to you to ask your thoughts on this.
So it's been a while that I've applied. I don't remember exactly what's required, but as general principles, I would say, don't lie in your application. That's a big one because you're gonna get caught and you're not gonna have a chance. And don't be ashamed with your experience. You might think that you don't have, that your CV is not shiny enough, but that's not true. You just have to present what you've done, what you have learned from what you have done, even if it's a small workshop you've organized in your medical school. In the delegation, they value local experience. They value as well big experience and small experience. So you might your CV just might, or your application might interest the delegation. Just give it a try and then hope for the best.
Thank you so much, Zainab. Antonio, why don't you give your take on this as well?
Yeah, I think speak for yourself, like share your thoughts, be yourself, show what you really are looking for. I think that's what make it a good application, to really share your motivation to attend the event, like what is moving you to come to Geneva and attend the WHA, like what you are going to do afterwards, because also you have to bear in mind that there are very few spots and you will be really privileged to be in this delegation. So there will be a lot of people who would like to be here and wouldn't have the opportunity because of a lot of things. So if you're privileged enough to come here, I think what you should state or what you should do is go back home and share this with others, to your colleagues, to your region, to your country, to at least from people around you. And I think you should reflect that on your application. Like, what are you doing afterwards? And also, what are you giving to IFMSA? Maybe, as Zineb said, your CV, it's not impressive enough, but what experience do you have that will bring something to the delegation? What is unique in you that no one else have, because of your background, because of your studies, because of whatever reason it is, well, will make you different from the others? That would be my two main tips for the applicants.
Thank you so much, Antonio. Anna, would you like to share your thoughts on this?
Yeah, I think Antonio said it all. I think you make yourself be special, because every single individual here, every single member of all our association is very special in your own unique way. And just try to highlight it in your application, because I believe there will be many general applications saying that global health is important. It's very important to do multidisciplinary collaboration. We all are striving to achieve that, but why you are the one who will be able to achieve something more, why you are the one that is special. In order to do that, I would recommend you do your research, like read all the papers that Iris have sent to you. I know it's a lot, but maybe just go through them and check what are the most important fields to tackle within the global health, because as I told you before, global health is such a broad topic there, and you cannot really address it all yourself. It's simply impossible. So find your own area of interest, or your own area how you could really contribute to improving global health, and try to show it in your application that this is the thing you want to focus on, this is how you can contribute to it, these are your ideas, show your ideas, and then I think your application could be unique and considered.
Thank you so much. I'm sure all of our applicants took very furious notes on all of your thoughts that you just shared. And I would resonate that you all have to find like some place that makes you passionate, that makes you want to get up on that stage, even if you're scared, even if you think no one would listen to you because you're a young person, or maybe you come from a country where there's not a big culture of listening to young people. But just find a place for you that makes your blood go running. And then just chase that feeling. That is like I would say, the soul of everything that we just talked about. So now I am going to start taking questions from our members who have joined the discussion, and feel free to just answer it spontaneously. So the first question is from Utku from Turkey. He's an intern doctor working there, and he is asking that if we would like to mention, how would this experience benefit a clinical physician? Like, what would they gain from this experience? Because in the day-to-day life of a doctor, how would they use the advocacy, capacity building, research and policy experience that they would gain from this whole experience and use it in their work as a practicing doctor? So yeah, you can go ahead with the answer. Okay, Antonio, I see you raised your hand. Go ahead.
Well, thank you so much for the floor again. Yeah, I will put just a simple example. You know, the international classification for diseases, it's approved at the WHA. And now, right now, there are discussions around putting aging as a disease. So you as a clinical expert or as a clinical doctor, you can provide your input to that at this level, because IFMSA have that word. I mean, maybe it's not one of the top priorities of IFMSA, maybe it is, I don't know, you will have to talk with Iris about that, but you can see what it's decided here, or the resolutions or the decisions that are approved here reflects on the clinical level. So that's just one example, and we can discuss many others, like strategies of WHO are approved this, and these strategies are guidance for countries or what they should do at the national level. So many high-level documents are approved at the WHO, and here you have the opportunity to provide the feedback as a clinician or as a young clinician on what should be included or what should be changed. Maybe it won't, because it's a really long process. All the strategies and all the resolutions and decisions that are approved here that are negotiated like beforehand or during 1 or 2 years. But here you have an opportunity to raise the voice from the youth perspective.
Thank you so much, Antonio. Anna, you want to say something about this?
Yes, thank you very much for the question. I believe it's a very good question, actually, and not only referring to the WHA itself, but even being involved in associations like IFMSA or IVSA. Many members ask me, I want to work in a clinic in the future. Why would I be involved in an association like this? And I think the reason for it is that it simply, it helps you to understand what you do not understand. It helps you to ask the questions which you wouldn't even know that you wanted to ask, being just a clinician and just focusing on the hard skills. So, and also raise the awareness about the important health matters. One of the specific examples I could give is antimicrobial resistance. So this is a topic tackled worldwide. It is tackled in a clinic. It is tackled by practitioners. It is tackled by policymakers. And if you are involved in, for example, meeting like WHA, you start to understand what is the role of practitioners in antimicrobial resistance and tackling it, but also how other fields like veterinarians are involved in fighting against AMR, and what you could do locally to contribute to that fight. The same we could say about emerging zoonotic diseases, for example, COVID-19, what are the policies, and also the other way around. So you could bring your perspective, your voice as a practitioner to the policymakers, and make sure that your work in the future will be just better, improved, because voice of practitioners must be there. The policymakers need to base their policies on something, and they need to base it on the real experience of the people working in the field. That's why we really need you there. So please keep that in mind.
Thank you, Anna. Yes, so this I would say this gives you an opportunity to not just be a doctor on the field and providing care to your patients, but you also get to speak and be a part of the table where the decisions are made for you and your patients. So it definitely gives you an edge over all your peers, and you all summarized this so perfectly well. And thank you for your amazing answers. So now I'm going to take another question, which is from Ibrahim bin Huzafa. So he poses two questions, so I can answer the first one. So he asked if there is a specific theme for the World Health Assembly. So I would say that there isn't a specific theme for World Health Assembly, but there is a specific theme that we have each year for the World Health Day, which falls on 7th of April each year. And for this year's World Health Day, the theme is protecting health from climate change. So quite an interesting theme. And I'm sure there will be lots of discussions about this in lots of top level groups and workshops during the meeting itself. As for his second question, so he asked, as he'd expect that this year, the meeting would be in a hybrid setting. So he wanted to ask us about how would the experience differ majorly between online and in-person setting. So I'm sure like most of our alumni who've joined us here are the fortunate people who got the opportunity to attend the event in person. So I will just ask you to briefly tell us about your in-person experience, and for the online one, maybe Iris can shed a little bit more light about how we managed the whole situation last year. So I would just ask you, yeah, you can spontaneously open your mic and give us your opinion on how was the in-person experience for you?
So what I remember is that we were all in one youth hostel. So that was pretty cool because we could see each other at breakfast and dinner. And then we would go for the PreWHA to the, if I remember correctly, the Geneva Institute, which lended us rooms so we could have our workshops there. So we would spend the entire day there and then come back to the hostel in the evening for 5 days. And afterwards, during the World Health Assembly, we would go to the Palais des Nations, and then each day. So within the delegation of IFMSA, there were small groups that dealt with different topics. I was part of the group that dealt with HRH, Human Resources for Health. So my mini delegation would stay together and we would have a plan that we had agreed on. We need to go to this talk, we need to meet with this person, or at least try, we need to do this. So we would have different schedules within the delegation with some major events that we would all attend during the week. I would say it was pretty intense, like very little sleep, a lot of work, a lot of socializing, and that was, I think, a pretty cool experience. I cannot comment on online, unfortunately, but yeah, that was how the in-person.
Thank you so much, Sinab. I'm sure it is also like a good for me to hear as well, because I haven't been a part of in-person World Health Assembly and Youth PreWHA, so it's fun to hear about what it used to be like. So Anna, Antonio, do you have anything specific to share from your experience when you were there?
Yes, so I actually attended the online World Health Assembly in 2019, and then in 2018 the live World Health Assembly. So I'm the lucky one. So I think Zinab summarized it well, pretty well what happened at the live World Health Assembly. I had the same wonderful experience, but I just want to highlight that you shouldn't get discouraged that it will be organized online. I'm pretty sure OSI is doing such a great efforts to make it also a wonderful networking experience for you, even in the online settings, because this is what happened in 2019. We were divided to some smaller also working groups, and we had some smaller Zoom sessions where we could have discussions, and we also got to work on projects together. So we were working on some hackathon where we like trying to develop a solution for different global health problems. And I was really lucky to chair one of the hackathon groups, and I just have so wonderful relations with the people I worked with, because afterwards I reached out to them and we actually collaborated together with them on a policy paper that was shared, IFMSA and IVSA policy paper. So we even brought this experience forward and worked together after the event. So I believe you will still be able to pretty much interact with the delegates and have a great experience even in the online settings.
Amazing, amazing. It's such a good thing to share, that you got so much done and you still have some connection and correspondence going on with these people. So that's amazing. Antonio, do you have anything to share specifically on this?
Yeah, so adding to what Anna and Zineb have just said, you also have the opportunity to have meetings with high-level people. For example, in the pre-WHA, well, and the WHA in 2019, there was a youth-specific side event where the general director of WHO joined us. So we also talked with the senior advisor for gender at youth, Diaz Aminarsi, and the person in charge of UHC 2030, the Initiative for Universal Health Coverage. And we get to share our thoughts on how does a WHO youth inclusive would look like. So we suggested a lot of things, and actually they used our picture for the Youth Council announcement that they made in December last year. So there you can see all the people, all the young people that were there, because it was not only the people from IFMSA, it was all young people that was attending the WHA. So it was a great opportunity to raise the voice for young people. So apart from the formal part, which is attending the committees and delivering statements, preparing that, you also get to experience that. And I think you can also contribute to IFMSA by talking with the delegations and push for something at the national level. In my case, I talked with the delegates from Panama and Colombia, and also from Mexico. So we push for the implementation of the Youth Delegates Program and from the support from the Health Ministry to their NMOs. And I think it worked quite well, at least in Panama, for example. So I think you can also change that to help your other fellow NMOs to improve their relationship with their Health Ministry. And yeah, I think you have a lot of fun. And at least in my case, I think it was one of the longest WHA because it lasts like 3 weeks or something. It was really big. Right now, they will be shorter from this year and on. But yeah, it was a really exhausting experience because, as everyone has said, you sleep very little because in the afternoon, you also go to side events. You also want to go out to have drinks or just work on the things that you're going to do next day. So it's a quite unique experience that I would really recommend.
Thank you so much, Antonio. Such a riveting experience, I can say, for all of us here. Iris, would you like to share some light on the virtual setting of the meeting and how the experience is overall?
Yeah, definitely. And thank you so much for the question as well. So last year's, I would say this year, in 2021, the Youth Pre-WHA was organized in the virtual setting, and it was organized in that setting from the beginning. And this made for an unique opportunity for the organizing committee to, from the beginning, ensure that the engagement would be there. Even though we were in the virtual setting. So we put a lot of effort in that as organizing committee to ensure that engagement, to ensure the social connections, and to ensure also impact with advocacy in that new setting. And I think that is something that is in our minds right now as well. So we're, from the very beginning, what we are doing as OC is thinking about how in this hybrid setting, which is again a new setting, we will make that engagement possible. So from our very first meeting, and even from before that, from the call for the organizing committee, for example, it's in there. It's central to the work that we do to ensure that that engagement is there. And the reason for that is because it is so valuable in a delegation with people from so many backgrounds to ensure that everyone's perspective is being heard and contributes to the efforts. And some people just might not be in the situation where they can come to Geneva, but we still want their perspective to be part of the experience and be part of the delegation's efforts and outcomes. So we see a lot of value in that, and we try to do everything that we can using technological solutions, using support. For example, if you do not have access to a good internet connection, we have financial support in place that can help you get access to a better internet connection. In addition to that, with the in-person, we also have a sponsorship grant there. So if you do not have the financial means and you come from a low or middle income country, you can apply as well to receive change makers a scholarship which might support you in your efforts to come to Geneva. So we try in many different ways to increase that accessibility and really ensure that all the perspectives are being heard. And we strongly believe that hybrid setting is the future. because of the way that we now have technological solutions and the way that in the pandemic we have worked in that virtual space. And it's really a way to ensure that we can make sure that everyone's perspectives are being heard. So just very specifically, an example is Zinab talked about the advocacy working group. So we have different groups that work on specific issues. Well, we will make sure that those groups have both virtual group members and in-person group members who can then contribute to each other's efforts. So we have in-person members at the WHA that can approach specific people that are there, and we have the virtual members that can work on the social media, for example, and try to search engagement or do more background research, and they can support each other in this really and create a synergy, so to speak, in that hybrid setting. So yeah, we'll do everything that we can to facilitate that engagement, and we've seen that it is possible because we've seen it in the past 2 years that even though it was fully virtual, very strong connections have been built within the delegation. So it's very exciting, and I'm really looking forward to see how it's going to go.
Thank you so much, Iris. I'm sure that cleared a lot of things up for our participants. I see Ibrahim has raised his hand. Ibrahim, if you have a question, go ahead.
First of all, I would like to thank you all of you for answering my questions in a very detailed manner. I just had a curious follow-up question to Anna. You just mentioned that there was a hackathon. So is the hackathon a regular thing at WHA? Because I did not know about that. And if yes, would there be a hackathon this year?
It was organized by the IFMSA during the pre-World Health Assembly, so maybe Iris could elaborate on it more.
Sure, yeah, thank you so much for the question. So Anna was actually part of the delegation that was in the Youth PreWHA the year that COVID broke out. So you can imagine that the OC had been working since September to organize the event, and then only, I think they heard just 2 weeks before that the WHA was not going to be in person or something like that. So it was a last minute shift. And the OC worked very hard and came up with the creative idea to have a hackathon as part of the Youth PreWHA experience. So that's how that works out. Right now, we are still developing the program. So whether that's going to be part of next year is still up in the air. But there might be similar experiences regardless of people bringing inputs and creative ideas for sure. Yeah.
Oh, thank you so much. Thank you so much.
Thank you so much, Ibrahim, for your questions. I'm sure they were so relevant, and we got to learn so much more discussing them from each other. So now I see that we are 5 minutes short from the close of our meeting. So I am going to ask our alumni to just tell us in brief words, what was your takeaway message after this experience? Like, how would you brief it out? How would you sum it all up at the end? And what did you take away with you when you went back home and explored your journeys afterwards? So Antonio, why don't you go first, and then we can ask everyone.
Well, it will be quite difficult, but I would say give it a try. Fill out the application, take your time, grab a cup of your favorite drink, think about how would this improve your career and how can you put this into action when you come back home. In my case, I really defined that I decided I wanted to study health policy before the WHA, but being there really confirmed that it was what I was looking for. So it could change your life. So give it a try, share your motivation, put yourself into the application, and best of luck.
Thank you, Antonio. Zainab, I'm going to pass the floor to you.
It's really difficult to sum it up in one sentence, but I would say it's an amazing opportunity that will probably, change your life, or at least redirect it. And if you don't make it to the delegation, I just keep trying if you can the next year. Follow what the delegation does on social media. Sometimes there are calls that they need extra help with some background research, and you could do that from home. So try to support what's going on, even if you're not there, and you will probably learn a lot in the process of how things are done in big meetings like WHA. It's similar things that go on in the UN General Assembly as well, in the COP meeting as well. So once you get the feel of how things work in these big meetings, it can help you understand more of these. So definitely something that you will not regret investing in.
Thank you so much, Zainab. Anna, I'm going to give you the last word.
Thank you very much. So I will just briefly refer to the meaningful youth participation. I would like you to remember that this is not only a nice sentence, this is real. You guys really can have an impact and you really have a voice, sometimes even bigger voice than the politicians that are being present there. Because remember, you're not part of any mission that needs to have a voice of a country. You are not part of any association that needs to have a voice of that association. You are there, an independent student, and you can basically say anything without any consequences, which gives you, okay, maybe not that much, you still need to have some limits, but it gives you the possibility to really share with this policymakers your opinion, make them think about important problems that you are affected by and have a real impact already here as a student. So use that opportunity, and again, best of luck.
Thank you so much, Hannah. I would like to thank everyone who joined us today. It was brilliant to have the discussion from our alumni who inspired us endlessly, and then also hear from our applicants who have such great questions and are already going to so many places. And I would just like to say that just the process of applying for this delegation is a capacity building and a leadership experience on its own, because not just you explore yourself, you also get to explore what you want to do in the future. So you want to go to the highest level of global health meeting, what you want to speak about. So this is a great moment of self-reflection and understanding your potential. And I'm sure that all of us would come out at the end of it as better leaders and better advocates for global health and global health equity, and for our communities and locally and nationally. So thank you all so much. I would like to say have a good rest of your weekend, and I'm sure we would be seeing each other somewhere soon. So yeah, best of luck.